Okay, let's talk about something scary. Something that can hit your dog suddenly. A real emergency that many owners might not spot right away.
Yeah, it's often called a silent thief for a reason.
We're doing a deep dive today into gastric dilatation-volvulus GDV. You probably know it better as bloat.
Exactly.
We want to break down what it is, what you absolutely need to watch for, and crucially, how you can help protect your dog.
Right. It sounds complicated, GDV. We're going to unpack it, make the vet science clear, give you knowledge you can actually use. That's the plan.
Okay, so let's start with the basics, the anatomy of this crisis. Bloat, in simple terms, is when the stomach just fills up fast, like with air or fluid or even food, and it gets really distended.
That's the dilatation part. But the really dangerous part, the killer, is the volvulus. That's when the bloated stomach actually twists.
Twists?
Yeah, imagine twisting a garden hose that's full of water. It blocks everything off, right?
Ah, okay. I get it.
So that twist cuts off blood flow to the stomach itself, to the spleen, other organs. And worse, it traps gases, allows toxic stuff to build up and get released into the body.
Which leads to shock.
Exactly. Profound shock. We're talking circulatory collapse. And without incredibly fast vet intervention, GDV is, well, it's often fatal.
Okay, fatal. That word definitely gets your attention. So spotting it early is everything. What are those first signs, the ones you might miss?
Absolutely crucial. Look, a swollen belly is classic, but honestly, it's not always obvious at first, especially in those deep-chested breeds.
Like Great Danes, Shepherds.
Right, their chests are so deep the stomach can expand upwards initially without showing much externally. But watch for them trying to vomit, but nothing comes up, like dry heaving.
Maybe just bringing up some white foam.
Yes, exactly. Or excessive drooling. They might seem really restless, pacing, can't settle down, maybe whining if you touch their belly or doing that praying position, front down, bum up.
Okay, those are definite warning signs. And you mentioned how fast this can happen.
It's terrifyingly fast. These symptoms can go from, something's off, to collapse, really pale gums, weak pulse. Sometimes in minutes. Seriously. Every single minute counts. No waiting.
Right. So who should be most worried? We know the cause isn't perfectly nailed down, but there are big risk factors, aren't there?
Oh, definitely. Breed is a huge one. Large dogs, deep chest. You mentioned Great Danes. There's something like 5 to 8 times more likely.
Wow.
Yeah. Saint Bernards, German Shepherds, Standard Poodles, Dobermans too. They're all high on the list.
Any other factors besides breed?
Surprisingly, yeah. Males seem to be about twice as likely in females, and risk goes up with age. But feeding habits, that's massive.
How so?
Eating just one big meal a day doubles the risk compared to smaller, more frequent meals. And dogs that bolt their food, fast eaters, 5 times the risk.
5 times. Okay, slow feeder bowls suddenly sound essential.
They really can be. And here's a big one that flips old advice.
Yeah.
Elevated food bowls. They were often recommended, right?
Yeah, I thought they helped prevent bloat.
Well, newer studies actually link them to an increased risk in many cases. So feeding on the floor is generally safer now.
Huh. That's a major turnaround.
It is. Also, dogs with nervous or anxious temperaments seem more prone. And exercising heavily right after eating is another big no-no.
Got it. So if the worst happens, you race to the vet. What's the immediate plan there?
First things first, stabilize the dog. They'll likely be in shock, so they need IV fluids fast. Pain management too.
Okay, stabilize, then what?
Then decompress the stomach. Get the air or fluid out. Sometimes they can pass a tube down the throat, but if the twist is blocking it,
Then what?
they might use a large needle inserted directly into the stomach from the outside. It's called trocherization. Once the pressure's down and the dog's more stable, it's usually straight to emergency surgery.
To untwist the stomach.
Exactly. Untwist it, check for damaged tissue. Sometimes parts of the stomach wall or spleen aren't salvageable. And then, crucially, they'll often perform a gastropexy.
Gastropexy.
Yeah, they basically tack or stitch the stomach wall to the inside of the body wall. It doesn't stop the stomach from bloating again, potentially, but it drastically reduces the chance of it twisting.
And that can be done preventatively, too, right? Like during a spay.
Absolutely. For high-risk breeds, it's a really important conversation to have with your vet. It can be a lifesaver down the road.
Okay, so prevention. Beyond considering that surgery, what can owners do day to day? You mentioned meals.
Definitely. Ditch the one big meal. Feed smaller portions, maybe 2 or 3 times a day. Use those slow feeder bowls if your dog inhales food.
Makes sense. What else?
If you have multiple dogs and mealtimes get stressful or competitive, feed them separately to reduce anxiety. And definitely no rough play or intense exercise for at least an hour, maybe even 2 after they eat. Let things settle.
So small meals, slow down eating, manage stress, and post-meal couch time.
Pretty much. And talk to your vet about that gastropexy, especially if you have one of those at-risk breeds.
This has been incredibly helpful. It really drives home how serious GDV is, but also that knowing the signs, the risks, and the preventative steps gives you, the owner, real power.
It does. And honestly, even with all the research, we don't have all the answers about GDE yet. It's still being studied, which just highlights how important it is to be vigilant, know your dog, and work closely with your vet.
A crucial point.
And please remember, everyone listening, this deep dive is for educational purposes. It's designed to inform you.
But it is absolutely not a substitute for professional veterinary advice.
Exactly. If you have any concerns at all about your pet's health, please consult your veterinarian. They're your partner in keeping your companion safe and healthy.